Suicide is defined by death caused by self-directed, injurious behavior with intent to die as a result of the behavior. And the sad part about it is every 40 seconds, someone around the world dies by suicide. In 2019, there were about 3.4 million people who have planned a suicide, 1.4 million people who actually attempted suicide, and just about 50,000 people who have committed suicide. The United States Center for Disease Control and Prevention cites that suicide is the second leading cause of death amongst the ages 10 through 34. And that is right after unintentional injuries such as traffic accidents. In addition, suicide is also a major cause of death amongst the elderly as well. In fact, for every one person who commits suicide, there are 20 other people who actually attempted suicide. And prior to any suicide or attempted suicide, a person usually has suicidal thoughts. And this is called suicidal ideation. Suicidal ideation refers to thinking about, considering, or planning suicide. And this ranges from passive suicidal ideation, when a person starts to think that they will be better off dead, to active suicidal ideation, when a person starts to make specific plans of dying by suicide. Fortunately, those with suicidal ideation don't actually attempt suicide, but there is no reliable way to identify those who will. Having said that, there are some productive risk factors to consider to identify individuals with higher risk of completing suicide. There is a risk assessment scale that can be remembered using the acronym SAD Peoples. Now, for this part of the video, I am going to utilize my phone just so that I can give you the accurate information, because it is a lot to remember, and that's okay. So S stands for male sex. A stands for age younger than 19 and older than 45. D stands for depression. P stands for previous suicide attempt. E stands for excessive alcohol or substance use. R stands for rational thinking loss. S stands for separated or single. O stands for organized plan. N stands for no social support. And finally, S stands for sickness. The more risk factors mean the higher risk of suicide. So some things to look out for in people that might be experiencing suicide or having suicidal thoughts is their mental health status, the amount that they're drinking and using substances. People who have lost a loved one or a family member, friend, or partner. People who are going through financial crises, and also people who have chronic illnesses. When it comes to suicide, there are social stigmas placed around suicide that leads to a person not feeling so good about themselves. So love from family members and friends help tremendously. And also having a strong social support network is proven to lead to better outcomes. The good news is that suicide is preventable. This can be done by identifying those who are at risk and offering counseling and therapy, as well as follow-up care for those who have actually attempted suicide. In addition, establishing 24/7 suicide prevention lifelines that are free and confidential can make a major impact, just as well as offering prayer lines for people to call into. Take care.